Hello and welcome. Today's episode is on the topic that touches many lives, fibroids. I'm Dr. BushraGul with 24 years experience of obs and gynae. My special interests are high-risk pregnancy and laparoscopic surgery. I will be your guide on this journey through understanding what fibroids are, who gets them, what causes them, what problem they cause, and how they are treated. Whether you are dealing with fibroids yourself, or you know somebody who is, or you just want to be informed, this episode is for you. So let's dive in. Fibroids are also called myoma, fibroma, or leiomyoma. They are benign non-cancerous uterine muscle growth, which typically happens middle or late reproductive age women. They usually come in multiples. They can vary in size from the pea size to the melon size, and there are three main locations of the fibroid inside the uterus. Submucosal is the site where it happens inside the uterus where your baby is normally when you're pregnant, just underneath the layer which shades every period. And then it could be deep in muscle. They are called muscular. They can be on the surface outside the uterus, which are called subserosal. Submucosal fibroid and subserosal fibroid, they can be attached with thin stalk. Then it is called pedunculated fibroid. And then there is one more form of the fibroid which is called cervical fibroid. Who gets a fibroid? Every third woman in the world can have fibroid. They are fairly common. Some races are more likely to have fibroid, like African Americans. If it is in those people who are genetically predisposed to have fibroid, it happens in them in a younger age, and it happens in multiple numbers, and they tend to have larger fibroid, and it runs in families too. And it can happen in those women who have increased level of estrogen hormone. Who are those people who can have increased level of estrogen hormone, like obese people or lifestyle choices? And for the same reason, fibroid do shrink after menopause because estrogen level decrease. So a lot of people, they ask, how do I know whether I have fibroid or no? That's really a tough question because fibroid can be totally asymptomatic. You may have no symptoms and you can have fibroid. And in some people, they cause fairly heavy, prolonged, clotty bleeding with the period cramps and the pain. And sometimes they could be very, very large to cause the bulk symptoms. That is the feeling of pressure in the pelvis because they are in the close proximity. In front is the bladder, or in the back is the rectum. So if they're very large and they're pressing on the bladder, they will cause urinary symptoms or frequent urination. And if they're pressing on the back, on the rectum, they can cause constipation. Beside bulk symptom and period problems, they can also cause acute pain, but that's very, very rare. If you have pedunculated cervical intrauterine fibroid, submucosal, sometimes it may want to deliver from the cervix. That's a very painful condition, but that's very rare. Fibroid during pregnancy also can cause acute pain because in pregnancy your uterus is enlarging, your fibroid also enlarge. So sometimes they lose blood supply, and because of the deficiency in blood supply, they degenerate, and when they degenerate, they are dying fibroids and they cause acute pain. Now, since fibroid is a very common condition, so let's see how it affects the pregnancy. fibroid generally cause no symptoms during pregnancy, and rarely they can be associated with the pregnancy complication, but even that complication correlates with the size of the fibroid. So if you have larger fibroids, you're more likely to have pregnancy complication, and if you have a smaller fibroid, you're less likely to have complications. And that one of the complication is again the degenerating or dying fibroid, just because your enlarging fibroid is losing blood supply, and that cause acute pain. People who are pregnant with the fibroid, they need extra ultrasound. Why? Because by seeing the uterine size, you cannot judge that how much is the baby growing, is the baby growing adequately or not. So to see the baby growth, we need extra ultrasound, and we also need to monitor how much your fibroid is growing in size. And cervical fibroid also has an implication during pregnancy. They may obstruct your normal delivery because of obstruction in the birth canal passage. So if you have cervical fibroid, you be mindful that you might end up in cesarean section. Since fibroid are very common, and people do think they may cause infertility. In past, it was thought that there is a link between the fibroid and infertility, but correlation of fibroid and infertility is very weak, because fibroid is fairly common condition, but infertility is not. Again, it depends on the location. If your fibroid is on the surface, subserosal or pedunculated, it may not affect any mechanism which can interfere with you getting pregnant. But if you have fibroid which is inside the cavity, obstructing the tubes or affecting the implantation, yes, your ability to have getting pregnant may be affected. Fibroid and miscarriages. There was a link thought between the fibroid and miscarriages, but those studies could be flawed, because fibroids happen in the late reproductive age, and miscarriages also tend to have increase in frequency in late reproductive age. But again, the location of the fibroid is very important here. If you have intrauterine submucosal fibroid, you have more chance to get miscarriages. Now, if you're wondering how doctor will diagnose your fibroid, and you might be having some symptoms and you're suspecting that you have fibroid, you may go to the hospital. Doctor will do the pelvic examination. By that, they might suspect that you might be having fibroid. They will order a pelvic scan that will confirm or refute the finding of fibroid. But that's not it, because your fibroid need to be known in detail about the dimensions, about their depth and their location. So MRI is done to know better details of your fibroid.